Good morning, colleagues. Good morning, UCT. My name is Professor Tracey Naledi. I am the chairperson of the Vaccine Mandate Panel. I am a public health medicine specialist by training, and my day job is that of the Deputy Dean in the Faculty of Health Sciences, and I'm responsible for health services. Thank you very much for joining us today. I'm here today with the Vaccine Mandate Panel that you might get to see some of them as they answer some of the questions, but I'll speak about that a little bit later. So without further ado, let us get to the business of the day, which is for us as the panel to share with you what we have been doing over the last few months and share with you the draft Vaccine Mandate Panel policy, and to hear your views on your thoughts on it, on some of your suggestions of how this policy will be strengthened. I will be doing this presentation with Professor Pierre de Vos, who will introduce himself. Actually, maybe Pierre, maybe do that first so that Pierre, my co-presenter and the deputy chairperson, maybe Pierre, you can introduce yourself now.
Yes, hello everyone, I'm Pierre de Vos. I am a professor in the Department of Public Law at UCT and also the head of the department, which is a terrible job, but here I am.
Okay, thank you very much, Pierre. So the way in which this is going to work is that Pierre and myself will do the presentation on behalf of the panel. Professor Shosikese, the Dean of Humanities, will facilitate your questions. So you'll see that you have an opportunity to ask us questions. So when you put them on the chat, Professor Kesi will be looking at the questions together with the Vaccine Mandate Panel members. Some of them might answer the questions as we go. Panel members, feel free to also answer on the chat if certain things can be answered, because we know you might have many questions. And then some other ones, particularly the cross-cutting ones or some of the really salient critical issues that we need to have a conversation about, Professor Kesi will raise them so that we can answer them. So our purpose today is to share with you our work and the work that is on the policy, and also to just note that the current policy that is for conversation and for discussion, it was finalized in December, and we are listening to comments and hearing what people are saying, and we are in the process now of amending it as we go, as we are hearing comments from you. Okay, so I think let's get on with it then, and to say, and perhaps before we, can you see my presentation, Kylie? Is it coming through okay?
Not yet, Tracey.
Okay. Can you see it now?
Yes, we can see it now.
So what I wanted to say first is that this work, even though Pierre and I are presenting it, there have been many people who have contributed to it, the Vaccine Mandate Panel members. We have also co-opted other colleagues within the university and other colleagues that we felt had useful kind of insights to help us. We've received technical support from the UCT executive, and also we have been learning from other institutions, because this bus has been going relatively quickly, so we've learned from others and have been consulting quite widely across the country with other institutions. So as far as this process is concerned, you might be aware that in September, the Senate adopted a motion that recommended a vaccine mandate to UCT Council. And what that recommendation said was that all employees should, as a condition of being able to perform their duties, employees and all students as a condition of registration provide acceptable proof of having been vaccinated against SARS-CoV-2. In October, UCT Council considered this motion and approved in principle that this proposal, and they had wanted at that time for this to take effect from the 1st of January. In that resolution, Council actually resolved that the executive should establish an appropriately constituted panel, and our job would be to develop the details of how this mandate would work, etc. Our first meeting as a panel was on the 10th of November last year. And our terms of reference as a vaccine mandate panel was really to establish the logistical and operational features of such a mandate, to set up the systematic principles, rules, and guidance that we would look for, that we would use for exemption and any processes that are related to that. And we would act as a body that would receive and adjudicate with compassion applications for exemptions from our community. And we would also monitor the effectiveness of compliance with the mandate and also the outcomes of this mandate. And we would also continue to review the evolving medical evidence and advise as appropriate if any changes need to happen, and really to continuously call on all members of the university to promote a voluntary uptake of vaccination. So these are the panel members that have been communicated to the community, and I've highlighted in particular the different diverse disciplines that members come from, and I think the executive really made a great effort to make sure that we are diverse and we bring to the conversation all this diversity. You have only there the titles of people's jobs, but you can understand that people actually bring much more to the conversation than their jobs, and certainly as the chairperson of the panel, I have been really privileged to be working with colleagues who are so diverse with so many gifts and contributions to make. And the approach that we've taken as a panel member is to have a robust and open discussion and come to a consensus into what it is that we would put forward as a policy. Okay, with that background in mind, I mean, we are here because of this horrendous thing that we've been living with over the last 2 years, the COVID-19 pandemic. And this is a graphic of what has been happening over the last 2 years. In summary, if you focus your eyes on those gray bars that give the number of new infections that we've had over the last 2 years, you'll see that we've had 4 waves. We had the first wave, we had the second wave, and the third wave, in particular, the Delta wave, which was absolutely horrendous. And I think many of us suffered and lost many friends and colleagues and family members. And the Delta wave in particular was particularly vicious. We have now since come out of the 4th wave, which is the Omicron wave, which we are at the end of it, which in fact was incredibly highly infectious. And as you can see with the gray bars on this slide, we had the highest number of new infections. However, this wave was relatively narrow, so it went up relatively quickly and went down relatively quickly, and in terms of severity was less so. So in our first meeting as a panel, we received an update presentation from Professor Graham Menkes, who unfortunately cannot be here today due to another engagement. But our first meeting as a panel was really to consider what new evidence has emerged and if there are any changes that we need to consider. So in summary from our presentation from Professor Menkes is that, as I said, we are now in almost at the end of the 4th Omicron wave. In fact, the experience over these 4 waves have been that vaccines have continued to provide significant protection against hospitalization and death, and that has never been more true than the experience of the 4th wave. And even though the vaccines have been found to be less effective in preventing transmission of Omicron, vaccinated persons have been shown to shed less virus, and they shed the virus for shorter periods and therefore tend to shed less virus more globally. And also, vaccinated persons are less infectious than those who have not been vaccinated. Furthermore, there is now new evidence that has shown us that there is protection from acquired from natural infection. However, this protection is less predictable and has been shown to be augmented quite extensively by the augmentation with the vaccine. So where we are right now is that I think the Omicron has been a positive experience, particularly with regards to loss of life and severe disease and hospitalization. However, the future is a little bit uncertain, and we are not sure in terms of what will be happening next. However, we can predict with a certain level of certainty and anticipate that another variant will emerge in the near future. Therefore, we need to continue to implement strategies that have been seen to work to date, and in particular globally, there is agreement that vaccines are safe and are effective and have been shown, as I've said earlier, to reduce morbidity, severe hospitalization, and death. However, more data on the efficacy of these vaccines in the context of Omicron in particular, as I've shared with you that it has behaved very differently to the other waves, is emerging as we speak, and as a panel, we are considering the information as we are receiving it and considering in whether or not there are any strategies that need to change, and not just us ourselves, but as you might be aware, there is conversation in the public domain around what the implication of all these changes are. So why a vaccine mandate for UCT? UCT, as you are all aware, is a residential university where in terms of our pedagogy, we really primarily use the face-to-face teaching methodology, because we believe that, we are not an online institution, and the way in which we impact on quality education is to provide face-to-face teaching and also provide other support services that we provide to our students, and also just having the academic community where we can all work alongside each other and learn with one another and from one another. So for us as a university, in terms of how we work, face-to-face is quite critical in terms of our work and ensuring the quality product that we can back. And we have as a community recognized the impact of online teaching, both in terms of our staff and the employees and students, and in particular the disproportionate negative consequences that have been felt by most the students that are mostly are in need. And I think as a community over the last 2 years, and in particular towards the end of last year, there was a support that we really need to resume to some kind of in-person teaching in an incremental way, as we can provide a safe environment to do so that we can go back to our pedagogy for learning and our collaborative research. At the same time, UCT has a legal obligation to ensure that we do this in a safe and healthy environment. I'll hand over to Pierre to talk about some of the legal authorities that UCT has. Over to you, Pierre.
Thank you, Tracey. So it's important to just quickly set out what the legal authority is. The reason for this is that to the extent that any vaccine mandate policy might limit rights, it can only be justified if it's done in terms of the law. So and the law is different. For students, basically it's the Higher Education Act and the Institutional Act that give council the power to institute either conditions for admission or change the student disciplinary code. These require, however, some specific kinds of consultations, which we are now undertaking. For staff, the most important thing to know is that the Occupational Health and Safety Act actually places a legal obligation on the university to protect to create a healthy and safe working environment for staff, and also to protect people who come into contact with staff. And there's been consolidated directions issued in terms of the Disaster Management Act that specifically allow employers in certain conditions to impose a vaccine mandate. So it is in the existing law in terms of the health of the Disaster Management Act. For contractors and visitors, there is the common law principle that you have a right to reserve admission to anyone, of course, as long as it does not infringe with other legislation like the Equality Act. So this is the legal framework. The next slide, Tracey. So when we started as a panel, we set out some principles regarding what kind of policy would pass constitutional muster, and so the principles are set out in this particular slide. The first thing that is also made very clear in the occupational health and safety directions is that you have to make sure that the grounds for exemptions are provided for in specific cases to comply with constitutional rights. You have to set out clearly so that it's easy for people to understand what the criteria for such exemptions are. You have to say what the proof will be that will be required to grant an exemption, and you will have to also set out clear deadlines for how to apply, what the deadlines are, and provide for an appeals process, because potentially this can impact on people's rights. So if you have an exemption process, then there has to be appeal to an independent and different body. We also concluded that it's very information that this policy shouldn't be implemented in isolation, that it should go hand in hand with dissemination of information, counseling, health referral, and so on, to provide every staff member and student in the university to be well informed, to make informed choices, and to do what is in their best interest and in the interest of the university community. At the moment, we are busy with the consultation process, which for some issues like the changing of rules regarding students are legally required, but also the consultation process is important to try and improve the policy and fill any gaps. And of course, because this is such a fast-moving situation, we provide in the policy for a review within the next 6 months. Then, just interestingly, last week, to give you an example of what the lay of the land legally is, the CCMA handed down a decision in which it confirmed that an employee who refused to get vaccinated in a company where the company had adopted a vaccine mandate, that dismissal was fair, and that the employers and that it was confirmed. From that CCMA decision, some interesting trends emerge, which happily is more or less reflected in our policy, I would say. The first is the importance of consultation before the policy is implemented. The second is that there must be some exemptions based on constitutional grounds. The third, and of course medical grounds. The third is that an employee who refuses to be vaccinated based on misleading false beliefs about the safety and efficacy of the vaccine may be on shaky ground when it comes to asking for an exemption. In this case, the employee was fired, clearly based her beliefs on not wanting to take the vaccine on information that were clearly not correct. Then also employees whose job required them to interact with colleagues daily whilst in a confined, uncontrollable space might find it difficult to be saved by an exemption because, as the CCMA ruled in this case, it might make that employer incapable of doing the job. The the impact of Omicron variant was not really considered in this case, but as a last point, I would just say that for me, the main, and it's not on the slide, the main point of the CCMA decision is that the basic approach to fairness was that employees have a duty of care also to fellow employees, and that will be considered when making an assessment about whether the employer acted fairly or not. I think it's now over to you again, Tracey.
So thank you very much, Pierre. And so what the vaccine mandate says, as we have it in the policy at the moment, is that there would be proof of vaccination that would be required from students, from staff, from independent contractors, joint staff, and visitors to access UCT buildings. All UCT employees and all these categories that I've mentioned, who, as you've heard from Pierre, the issues really around contact or with other people on the campus, and including also contact with research participants in the community. So if you are a staff member or a student and you are doing all those things that put you into contact with other UCT community members or research participants as a result of you being a UCT student or staff, the mandate applies to you as well. And all events that will be held on UCT campus and premises. So anybody who really would like to come onto our campus, this mandate is applicable to them as well. And currently, as you heard in the beginning, what the council had said was that this needs to be conditional on registration. However, because we really only start as a panel in November and we have to go through the consultation process, we felt that it was not reasonable to expect that this could happen as a condition of registration, and therefore this could happen in 2023 as council allows. However, we have proposed that we can also use the mechanisms that I will speak about as I go on to the presentation. So the guiding principles, and Pierre has touched on this a little bit, that have guided us as a panel as we have proceeded with our work, is that we foreground the right to quality education for all students in a safe and healthy environment. And I've spoken a little bit earlier around the view that we have as a UCT community with regards to our ability to deliver on that quality education. Secondly, is to really uphold constitutional rights of people and make sure that we can respect them and uphold them. However, whilst we are balancing it with the need to safeguard the health of students, of employees, and any other people. And to also ensure that if we are going to apply any limitations to anybody to those constitutional rights, we make sure that we limit the seriousness of these limitations and ensure that there is fairness of the exemptions that are provided and that the mitigation steps are just. Furthermore, which Pierre also touched on, we believe very strongly that the UCT community must make an informed decision. So when you are going to take that vaccination, you need to have all the facts about the potential benefits and the potential harms of the vaccine and know exactly what it is that you are doing. So you'll be aware that in fact UCT as a community, even before the vaccine mandate panel was established, the VCT, the executive and CMD have been communicating quite frequently with regards to COVID-19, how to protect yourself, how to protect your community, and UCT has also been in partnership with the government, established a Community of Hope vaccination site on campus. The other guiding principle is really around igniting agency of everybody in the community. As you've heard from Pierre, there is really a responsibility on all of us to take reasonable steps to limit transmission of COVID-19, to keep ourselves safe and act in solidarity with our community and take the vaccine, even in contexts where perhaps for us as individuals, our risk might be lower than others, but to understand that we live with the community with others, and that what is important with regards to this vaccine mandate is social solidarity, so that I protect myself, so that I can protect you and others. And quite frankly, there are some in our community who may not be able to take vaccines because of medical reasons in particular, who are at high risk. So it's quite important for those of us who are healthy, who might also be at low risk, for us to take the vaccine in the interest of the community that we belong to. So in terms of the policy objectives that we have, and I think it's important to repeat again that the policy objectives are in recognition that when we have implemented online teaching and it has completely replaced in-person teaching, this has had negative consequences on the academic project. Therefore, as a policy, we aim to promote and enhance a safe and healthy working and learning environment, and really so that we can provide the best possible education to the students as the regulations allow us to do so, and have an in-person teaching program, and also for our staff to make sure that we can provide the best possible opportunity to participate in the academic project and go back to collaborative research and engage scholarship. So what the policy statement therefore is that UCT has decided that COVID-19 vaccination is a prerequisite for any individual to physically enter the UCT campus and the UCT buildings. And it will be regarded as a condition of employment for staff unless otherwise determined, so that we can allow face-to-face teaching, learning and research in our community. And really for our visitors and anybody else, that we will be requiring that if you are going to enter our campus, we can verify, have a verified vaccine certificate. However, that if people come onto the campus, particularly new students who come onto the campus, we will allow them to come, but give them time to be able to get a vaccine and apply for exemption if so required. And as we have been doing, is to ensure that there's accessible vaccination services that are available together with other prevention care and support services that UCT has made available, as has been the mandate of the university, and ensure that we have access to information, relevant counseling, etc. You will recall that the VC communicated to the community in December. Within that communication, and we've been continuously communicating and providing information where students could get further information, and they could have received counseling, they could ask questions of the staff at Student Wellness. We have staff waiting and readily available to actually have one-on-one questions for students, and for complex questions, we have staff at the Faculty of Health Sciences that are ready and willing to assist with any complex medical advisory services. And notwithstanding, we will continue to implement the regulations as the law prescribes. So the approach that really we've taken as we've looked at this as also prescribed by law is to ensure that we reduce risk. And in reducing risk, the approach has been to consider three things: to consider the virus, and I've spoken a little bit about the considerations with regards to the virus that I will not repeat here. The second is to consider the host, which is the person in which the virus lives, and I've spoken a little bit with regards to vaccination program and what that has done with regards to preventing, to protecting individuals from a prevention perspective, transmission perspective, severe hospitalization and disease. And the third is to look at the environment. Okay, and so with regards to environment, the occupational and health and safety colleagues have done macro level assessments at high level, looking at the venues and really trying to critically think, to check if our environment is high risk or not. From the macro level risk assessments that have been done already, the conclusion of those assessments are that most employees are in increased risk of infection or spreading infection to others due to the activities of teaching, training, clinical service, and research, because, as I said earlier on, we are really a residential university where collaboration and working together is quite an important part of what it is that we do. In addition to the macro level risk assessments, the colleagues are also in the process and are actually nearly complete, if not completed already, to do more granular assessments of the venues to really try and critically think if there are any circumstances or any considerations where any workplaces could be considered to be of lower risk, such that we can really treat people fairly. So if there is that unique individual who works completely by themselves and is not interacting with others, so that we can make sure we can accommodate that in the exemptions. And with regards to the persons, the host, we have also been doing personal vulnerability assessments, and because in terms of the Occupational Health and Safety Act direction, they classify persons who are over 60 and with comorbidities to be of high risk, and in particular that those ones would be, from an individual perspective, be classified as a high risk individual. In particular, there is also, because what is the point of having all these risk mitigation if you are not going to check and make sure that they are being implemented? There is currently an auditing of compliance of all of these issues and a reporting of that already exists of that within the university community with regards to reporting when you are COVID positive, and also a principle that if you are not feeling well, you need to stay home. There is also isolation that is available for residential students and also other students, and that is included in the policy, and I'll encourage you to read and see what is available there. I'll hand over to Pierre now to talk about the exemptions.
Okay, thanks, Tracey. So obviously, the policy, as I said earlier, has to provide for exemptions. There are really two kinds of exemptions. Medical exemptions for medical reasons, and then for constitutional reasons, which includes the grounds of religion or other strongly held belief. We explicitly did not only say religion because we want to capture what the Constitution actually says. And it protects not only freedom of religion, but also of conscience. In section 15 of the policy, you will see all the details of exactly how these grounds are defined. So maybe if that could be shared in the Q&A bar, that will be helpful again, so that the whole policy, so that people can have a look again. Those exemptions will then be considered by an exemption panel, one for medical grounds, one for the constitutional grounds. If a student or staff member is exempted, they will have access to UCT buildings with one exception, and that is UCT residences, where a separate process, it was decided that those students would not be able to access residences. Exempted staff and students will, however, when there is a wave of COVID in motion, so to speak, they will have to take and provide a weekly COVID-19 negative test, and the exempted staff and students will also have to screen negative on a daily symptoms check. Students who are not exempted and has not provided any proof of vaccination will, in terms of this policy proposal, have no access to UCT buildings and campus, and are subject to disciplinary action if they transgress this rule. As imposing this rule, of course, is one of the reasons why we also have to have very formal consultations with various stakeholders. Staff is slightly different in the sense that whether they're exempted or not, it really depends on whether it's possible for them to continue doing their job. If it is a condition of employment, that it might be a condition of employment that they get vaccinated. And if no exemption is given, or if an exemption is given, then there's an obligation, a legal obligation written into the policy that the employer UCT has to take to try and reasonably accommodate that staff member. In the policy, there's a long list of examples of what accommodation that is reasonable will entail, and it will depend from employee to employee. For some, it will be easy to accommodate them because they can do their job from home. They're not interacting with the public, with students, whatever. For others, it will be more difficult. As I said, there will be two vaccine panels to hear the exemptions, and then an independent appeal panel. Next slide, Tracey. So if students or staff refuse to vaccinate, in line with what we said earlier, the policy is trying not to be overly punitive. So there will be another opportunity for staff and students to be counseled, to be referred to medical experts to advise them. And for staff, the reasonable accommodation that I spoke about on the previous slide will then have to be engaged with. It's only as a very last resort where it's not possible reasonably to accommodate a staff member, and when the staff member has not been vaccinated and refused to be vaccinated, that the possibility of separation will occur in terms of the staff member being incapable of doing their job. The CCMA award that I spoke about earlier made exactly this finding, that the employee had become incapable. There was incapacity. She could no longer do the job for which she was employed, and there was no other job to give her that she could be accommodated in. Students are different in the sense that they are not governed by the directives on occupational health and safety, so there is no legal obligation to accommodate students in this way, although, as we've explained, there are ways to soften the blow, so to speak. The next slide. So what many questions that were raised as the panel sat was about practicalities, like what happens when somebody is vaccinated? Maybe they were persuaded to vaccinate because of the mandate, and what are the practicalities around it? So the policy provides for that. Firstly, the staff are entitled to reasonable time off for the first 60 days after the policy came into effect to get vaccinated during normal working hours. Staff are not expected to do this in their own time. If they experience any side effects, then the staff will be provided sick leave. Students will be able to apply for a leave of absence, and the normal rules about being sick and not available to write tests or whatever will apply. There's also provision made for a claim if you have exhausted sick leave for the year and you are impacted on by having taken the vaccine. You can make a claim for compensation in terms of quota, and there is also, of course, a possibility to approach the unemployment insurance fund. The next slide, one of the other things that many people who engage with the panel asked about was the claims for vaccine-related injury. So some of the fears about vaccines centers on the idea that the manufacturers of vaccines are not indemnified from any vaccine-related injury. This is, of course, rare, as the medical evidence shows. But if there is such thing, then in the ways that are set out in the slide, the government has created a national COVID no-fault compensation vaccine injury scheme. And every person who gets vaccinated and who do experience a rare vaccine injury of a serious nature is permitted to approach the fund and to be compensated for it. It's a no-fault compensation scheme, so one does not have to show that the vaccine manufacturer or somebody else was at fault. What you have to show is that there was an injury, and that injury was related to being given the vaccine. This is not a scheme that's run by UCT, it's a government-related scheme. Then the next slide, the provision that I think has become a little bit controversial is that there's a section in the policy that says if you make false information or provide false information or misinformation and you spread it with the intention to dissuade people from getting vaccinated, it could be a disciplinary offense or a breach of contract. The important part here is that merely spreading false information or misinformation about vaccine is not sufficient. You have to show, if you're going to be disciplined, the disciplinary hearing has to find that you did so with the intention of dissuading other people of being vaccinated. Non-compliance with obligations imposed by this policy, including the ones about access to buildings and so on, can then also, in terms of the policy, lead to disciplinary action. On the next slide, as I've already noted before, Tracey, you can just move on. This is a fluid situation, so there will have to be firstly look into who is affected, who is not affected by this policy within the first 3 months. There will be there's also provision for continued review as the evidence becomes available, and there's that could be on the initiative of the panel. But there's also built into the policy mandatory review after the first 6 months to see to what extent the policy has achieved its goals and to consider whether there are other ways of amending or tweaking the policy to make it more effective. Here you see the time frames. It's a relatively tight time frame, but we thought because this kind of consultation is so important, we made it a little bit longer, the whole process, to make sure that there is really meaningful consultation. The important thing is that there's a deadline at the end of this month to submit any comments, and I really hope that those who have looked at the policy or have suggestions for improving or amendments or point out that there are gaps in it will make use of the opportunity to make submissions to the panel, and the panel will then have a deadline of 14 February to somewhere there to submit the final report in which all the comments and suggestions have been incorporated and been considered to submit it to the relevant structures. The final decision is supposed to, or is hopefully going to be taken by the council on the 2nd of March, or the 12th of March. Before that, the policy cannot be implemented because there is not yet a legally adopted policy. So the intention is, as set out in the policy, that the implementation date will be the 1st of April. So that is all. Sorry, this was quite a long presentation, but we tried to at least capture the main points of the policy. There is now an opportunity for the members of the panel to answer the questions that you can pose in the Q&A, which is at the top of your team screen with the question mark. So I'm going to hand over, I think, to Tracey Kesi, who will manage the Q&A session.
Good morning, everyone. Thank you very much, Tracey and Pierre, for that presentation. So I'm going to try my best to moderate the question and answer session. We have over 100 questions, so I've tried to organize a few already into different areas, and I apologize in advance if we don't get to your question. But a lot of them are similar, so I'm going to try and group them and give the presenters and other panelists a chance to respond. So I think to start off with, I want to take questions around the reliability of the science. There's a lot of questions in that area. And so I thought if the panelists could answer questions about the fact that the vaccine doesn't prevent transmission and infection, so how would the vaccinated be considered safer? There's a question about the virus going endemic and containment is no longer possible, so why is a vaccination necessary? Some people have commented that Omicron has passed, so what is the use of a vaccine formulated based on outdated S protein, and based on original pre-alpha stream. And then related questions around, yes, another one, Omicron has shown that there's no community benefit to the vaccination. So what is does the rationale for the mandate still hold? So I think there's maybe that first set of questions around the reliability of the scientific data. Some people have referred to global trends as well. And maybe also, as part of that set of questions, if you could say something about why the tests in the policy are required for the vaccinated the unvaccinated only, given that vaccinated people can still get sick and transmit, and also why the requirement to be vaccinated if you've had COVID already. So what is the role of natural immunity? I think let me leave it there for now. There are others still. Thanks.
Okay, I will do my best to answer as much as I can, but as I said, so maybe what I didn't say earlier on is that the questions that have been raised will be taken onto the list of questions that we are receiving already on the vaccine mandate panel email address that we've sent. So send us an email, and these ones also will include in there, and the response to all of these will be part of the final report. So we will we'll do our best to be responsive to all your questions. So maybe if I can speak with regards to the new evidence, the first thing I'd like to say is that the policy that you have before you was developed before Omicron. So the prescripts that you have in this policy, it is correct to say that they are slightly dated. In fact, this afternoon, the medical working group is meeting to consider some of the emerging evidence from the epidemiology. However, as I said also, is that we did as a panel receive a briefing from Professor Menkes in the beginning of the year. This is a few weeks ago, article which highlighted that yes, even though it is true that transmission, in particular, the vaccine effectiveness has reduced with regards to vaccine transmission, but the evidence still holds that those who are vaccinated shed the virus for shorter periods, therefore on a global scale are therefore less infectious. I was reading an article yesterday that was also suggesting that those who are not vaccinated are 5 times more likely to transmit the virus than those who are unvaccinated. So yes, even though there are still breakthrough infections, even with those who are vaccinated, but currently the evidence is that those that have received a vaccine are less infectious. With regards to natural immunity, that is true. I did show that, in fact, with the Omicron, there has been a huge, quite extensive transmission of the virus. So there is now very large, very wide coverage of natural immunity within the community. And this is one of the issues that we are considering this afternoon. So we are talking about that. And with regards to outdated information, as I said, I think our approach is kind of to paraphrase Maya Angelou, is to say that, you know, you do the best that you can, and as you get more information, as you know better, you do better. So I think that is our commitment as a panel, that as we receive information and listening to you, this is all part of also hearing what we need to amend within the policy. So thank you very much, Shoso. If I might just add, maybe the other thing that were asked with regards to community benefit that maybe I didn't answer on. In fact, I would argue that there has been community benefit. I mean, one of the early on in the presentation, what we showed is that the vaccination has continued to protect people from severe hospitalization and from death. So it has provided community benefit. In fact, the vaccine has provided the community benefit because we really have managed to reduce the deaths and hospitalization. Thank you.
Thank you. Thanks, Tracey. I'm going to ask a couple of more questions relating to the medical science. So I have a question here. Why is pregnancy not considered a valid reason for refusal to vaccinate until after birth? And then there's some questions about the actual vaccination itself. So what is this vaccine? What are the ingredients, the constituents? There's questions about infectiousness and how infectiousness is measured among the vaccinated and the unvaccinated. And related to that, does UCT believe in asymptomatic transmission, contrary to your statement by Anthony Fauci? Is community immunity only possible with vaccination? And then a third kind of area is that the comment is that the policy does not mention the adverse effects of vaccines. And this is something that is the policy also commits to in paragraph 4.1. I think Tracey, those questions are for you still.
Okay, you're gonna have to give me a break, Shoso, and ask some legal questions as well. With regards to pregnancy, I think what the advice from the obstetricians are saying is that really, I think for me, what has been quite important with regards to some of these issues is to look at what is the best thing to do. And I think, as I said, the evidence that we have may not be complete, or we must do the best that we can with what we know. Certainly, the evidence is that pregnant women are also at risk. And if you consider the risk of actually getting infected versus any risks that you might have from the vaccine, on the balance of it, when you look at the risk profile, actually getting a vaccine is, in terms of benefit, has a lot more benefit than actually allowing the pregnant woman to actually go ahead and get infected. Okay, so this, as I said, is as we know with regards to the evidence. So that is why, in fact, there is a strong recommendation that women who are pregnant should also get the vaccine. And in fact, what the medical experts tell us is that there are very few medical conditions that actually preclude from anybody from getting a vaccine. That in fact, many people come in and will say that, I've got comorbidities, I've got this condition, etc. That in fact, those very people are the ones that are at high risk, and in fact, that they should be getting a vaccine. But as I said, we do recognize that people have their own individual issues, and what we've made available is for people to have somebody that they can speak to. And if the staff that we have within student wellness or occupational health and safety is not able to assist people, we have people within the Faculty of Health Sciences who are experts, who are ready and able to help people. Yes, as I said, the new evidence does suggest that there is asymptomatic transmission, but as I said, there is a difference in that transmission when in people who are vaccinated versus those who are not vaccinated. And yes, there is absolutely natural immunity, and in fact, with Omicron, that has increased significantly. And as I said, we are taking that under consideration this afternoon and seeing what impact that would have. And yes, we take the comment in that we have not included any adverse effects. We can put a link on the policy where people can receive further information with regards to some of those details. Thank you, Joseph.
Thanks very much, Tracey. Okay, let me give Tracey a break and ask some of the other questions. I think generally around the ethics. So there's a question about, and I think some of them have been responded to in the presentation, but I think maybe we should just reinforce some of those responses. So how is the constitutionally required informed consent possible if UCT forces staff and students to jab? The second question, is the vaccination a requirement for new staff? And maybe, Pierre, you can also address the question of disciplining of people who spread misinformation. I know you mentioned it at the end of the presentation, but I think there's the question about who is going to determine what that misinformation is and the intent of the person giving the supposed misinformation, as well as, and the question is, isn't that censorship? Thank you.
Okay, so other members of the panel might also want to answer. I think the last question is an important one about disinformation, who decides what is disinformation, and so on. And it links also to the questions that Tracey previously answered about what's in the vaccine, what about side effects, and so on. From a legal perspective, we know that our courts, and this was made very clear during the controversy around HIV and AIDS and antiretroviral drugs, the courts tend to accept the prevalent view by experts. Maybe there is, so when it comes to, is the vaccine safe, the court is probably not going to take note or accept views that are outside of the medical mainstream. So that is an important thing to mention. When it comes to disinformation or misinformation, the same principle will then apply, but I think it's a good point in the sense that maybe there needs to be something added to the policy to define or to say a little bit clearer what this is, because in terms of basic rule of law principles, if you have a rule that people can face consequences for if they break it, it needs to be made very clear. So thank you for that. Yes, vaccination is a requirement for new staff because the panel, I forgot now where it is, but it becomes a condition of employment. About informed consent, the principle of informed consent, at least from a constitutional perspective, is that somebody must be able to access and be provided with the opportunity to access the accurate, clear information and then to make a decision about it. In the case of a vaccine mandate, that decision stands. Of course, the complication, as alluded to by the questioner, is that there is practical pressure on a person to make a decision which is not going to be to their detriment. The argument would be that to the extent that you're still making an informed consent, your informed consent is influenced by other factors, and to the extent that might prod you in the direction of making a decision that you might not have wanted to have made, the constitutional argument would be that it is justified because the purpose of having this policy outweighs the minor limitation that it imposes on you. Especially the minor limitation will be assessed based on the predominant medical consensus and not on assumptions that are not generally shared. The big question will be, if such a policy is going to be challenged in the court, is whether the policy strikes that balance correctly between the interest of the individual. Is it correct that the limitation on that person's freedom is minor? And is it correct that the purpose of the policy is, in such a case, more important and more pressing than that minor thing? How the court will come out, I think, depends a lot on the medical evidence. So I won't say anything further than because I am not an epidemiologist. That's all I think. I hope I answered the questions. I don't know if anybody else in the panel wants to add.
Thank you, Pierre. I think I might ask Barbara, if she's here, to answer, maybe to add to the answer, but also there are a lot of questions about whether staff are going to be fired if they don't want to get vaccinated. And I think, let me just read one here that relates to the Department of Labour. So Anonymous says the intent, core policy of UCT's draft policy is to mandate vaccination for every employee, while the intent of the Department of Labour directions is to mandate vaccination for only the exceptional cases identified as high risk, and that these few people do not lose their jobs but remain in their employment if the employee chooses not to be vaccinated. There is no legal basis in labour law to allow UCT to make mandatory COVID vaccination part of one's conditions of employment. Please explain why UCT's core policy is diametrically opposite to the Department of Labour's direction on this matter. Over to you, Barbara.
Okay, thanks, Sashi. I'm going to cover the question relating to whether employees will be dismissed if they refuse to be vaccinated. And I think Pierre has touched on the principle that will be followed when we're dealing with issues of vaccination, starting from where a person decide not to vaccinate, then they need to rely on either medical ground or the grounds that are highlighted in the Constitution. And the employer needs to look at those exemptions. And if the exemptions are not granted, there's a process that needs to be followed. I will touch specifically on the employee side. When an employee refuses to be vaccinated and rely on either those two grounds, and the assessment is done and the outcome is that the exemption is not granted, there are process that the employer needs to follow, and one process is to accommodate the employee. So some of the panel members have already highlighted to say the issue of accommodation depends on the nature of your job. If my job requires that I come on campus every day, accommodation might not be possible. So in those circumstances, the Labour Relations Act is very clear. And I think Pierre has touched on the CCMA ruling that has just been pronounced a few days ago. The employee will be taken through the process of incapacity, and that process will be the one that determines where accommodation is not possible. Then there may be termination of employment under those circumstances. If there's no place where the employee can be accommodated, meaning an employee has been appointed by UCT, but however, you are unable to perform the job that UCT has appointed you to do, so that could lead to termination of employment. I hope I've addressed the question. Thanks, Sush.
Thank you. Thanks, Barbara. I want to ask some of the questions around, I guess, more practical issues, operational issues, the monitoring of the policy. There's been a few questions about the UCT daily screening app and why it's no longer applicable. Is it no longer applicable when accessing campus? There's comments about there are no consequences for people not wearing masks. And also, is UCT considering better ventilation in venues and enforcing the wearing of masks again? How will we monitor that staff are vaccinated for access to campus? Kirshni?
Thank you, Shozi. I hope everyone can hear me. So just to let you know that there is monitoring still taking place for the daily screening, for the symptom screening. So it is taking place. It's just that it's not, we don't have the security checkpoints in place. So we're just moving to a more trust-based system now. But there is still monitoring taking place online, and that's behind the scenes. So there is a consequence to that. So anyone who's not completing the daily screening when they're on campus, this would be escalated to the individual themselves as well as to the line manager or head of department. So that's the one question. There's still monitoring. I mean, there'll still be, we also expect people or persons in positions of supervision, etc., to also monitor and to also ensure that, for example, in a classroom situation, if you have people not wearing masks, that they would also enforce this, and disciplinary action will take place. Was there something else that I missed? I felt that there was another question related to that. Oh yes, the monitoring of the vaccinations. So there is, currently we've got the development team that's working behind the scenes. And so this would be part of the COVID Health app. So there will be an application where vaccinations would be loaded onto it. And there would be about, we'll work out the numbers, but there are going to be data capturers or verifiers who would verify the vaccination certificates.
Thank you, Kirshni. I wanted to, Pierre wants to respond.
Yes, so I wanted to, the previous question as part of his question, I think we didn't answer that clearly about the direction really only allowing for mandatory vaccination of certain exceptional employees. The direction, as I read it, says that the employer must make a general assessment about a risk assessment about the workplace, and then they must decide, will they impose a vaccine mandate? That is set out in section 3.1.2 of the direction. Then it says, of course, that the individuals who are working in a situation where there's a risk of transmission or they have comorbidities or whatever must particularly identify. How our policy deals with that is really to apply that to the reasonable accommodation aspect. So if you are if you can be accommodated in a way that you're not going to pose a risk of transmission to everybody else, you can work from home, for example, then that will be accommodated. That is at least how the policy understands. I hope that helps.
Thank you, Pierre. So there's a question about students not being able to get proof of registration without the vaccination. So that's not accurate. Students can register, and as Tracey or Pierre mentioned in the presentation, there's still a process that needs to be followed. Whatever amendments are made to the policy following this consultation process has to go back to council, and only council can decide whether to adopt or not. So students will be able to register this year. I want to pose the next question, which is about data. So what is the current COVID-19 vaccine coverage for UCT for students and staff? One cannot use provincial and national averages to craft a local policy. And what is the target coverage that will take UCT back to normal? As high as possible is not an acceptable answer when the policy accepts exemption. I don't know if anyone wants to take that question.
I think that's a very good question. So thank you for asking that. We agree that it's important for us to understand what the prevalence of vaccination is. And unfortunately for the university to do a survey that would give us that estimate for UCT was going to cost us 300,000 Rand. So we decided not to use UCT funding for that as a panel. With regards to the information that we really have surveys that have been done for students with regards to SRC did a survey with regards to students' views of whether or not they agreed to vaccination and will be vaccinating, and also the academic union also did a survey. So in all honesty, we do not have a good estimate of what the prevalence or the coverage of vaccination is in the UCT community for students and for staff. And I think we are basing the information that we have from the Department of Health, but we are hoping as we proceed with the process that we will be able to gauge as people upload their vaccine certificates on what that is. With regards to what kind of prevalence we require at UCT, I cannot answer that question, and as far as I'm aware, even others within public health, etc., have not been able to answer that question, and particularly complicated by the need for boosters. However, we note the question, we note the concern, and we will take it back into the work group conversations, and we will respond to it with the wisdom of others as well. Thank you, Shosa.
Thank you. Thanks, Tracey. I just lost access to the Q&A, but I think there was a question I remember from before, and it was about whether medical students should be on the medical exemption committee. So the question is it ethical to have medical students on the medical exemptions committee? Medical information should be treated confidentially. Would anyone like to answer that, Tracey?
Yes, I think the approach that we've taken with regards to the vaccine mandate panel, as you've seen, is that we have been inclusive in terms of having staff members, unions, and student representative on the panel. Similarly, you will know that when I showed the terms of reference, part of our terms of reference is that we would be part of the exemption panels as is set out by the council, the people that gave us this job. So the reason that we, within the vaccine mandate, within the constitutional vaccine exemptions panel, students from the SRC would be represented in that because they are part of the panel. And I think the reason we are being inclusive with regards to panels is such that we could have within those panels people that would be able to hear and understand perspective of different members of our community. So we think it's important that students are also part of the decision-making process that determine whether or not exemptions will be given. So that is a general principle. However, when it comes to the medical panels, you are correct, the person who's asked the question about with regards to confidentiality of information. That is in fact the reason why we've included only medical students, because medical students are kind of covered by the shared confidentiality that we have as health workers, because they are health workers, and medical students who are likely to be part of this panel are likely to be either senior students, either sixth-year students who are undergraduate, or registrars who are already in fact doctors and are specializing. So we think it's very important that the panels are inclusive and have the key communities within UCT are represented as far as possible in those panels, so that we can make sure that actually we are truly listening and hearing to people. So that is the rationale of that decision. Thank you.
Thank you very much, Tracey. I'm going to just read out a few comments. So 100% in agreement with mandatory vaccine with the view of protecting the UCT community as a whole and wider population. However, the micromanagement of ensuring compliancy to physical access at UCT is an almost impossible, arduous and expensive task. This needs to be critically reviewed. I don't know if Kirshni, you want to comment again on that? We spoke just about monitoring staff and vaccination of staff, but I guess there are all other types of monitoring on campus in terms of wearing of masks, social distancing. Is there anything you'd like to add in that respect?
I'm sorry. So yes, thank you, Shozi. So like I mentioned before, we want to move away from those physical security checkpoints and, and the policing sort of culture, and to move more towards people managing themselves, But the monitoring is taking place online and it's taking place in the background. So if, for example, a person is not vaccinated, or they haven't uploaded their certificate or their card or the booster jab, etc. So there will be means in which that's the approach right now, is that we would basically restrict access to certain systems, and so that it's actually going to be uncomfortable for someone to be on campus if they're not going to be able to access SAP or access PeopleSoft. So those are the sort of the thinking behind it. So we're very much driven by people managing themselves. By now, I think everyone needs to know what the physical distancing is, that they need to wear the masks, they need to sanitize. And where cases were observed where people were not following those protocols, it was escalated, And so, you know, the appropriate disciplinary action would have been taken.
Kirsty, while you're
something else.
Yes, can you also just comment on if there's any requirements for visitors, delivery people, people accessing campus?
Yes, so the policy is applicable to visitors and to contractors. So we've got third-party contractors, staff, etc., who have already been communicated to perhaps just prepare them if we indeed go with the mandatory policy. And that is already being built into contracts, etc., so that they will comply. For example, the COVID protocols are part of the contractor management procedures currently. So that is being enforced in that way. And then visitors, there will be different classification of visitors, because you do have people who come through who are not physically on campus, but may just deliver and have a drop-off point or collection point. And then appropriate measures would be placed and put in place for that. But you do have visitors who are going to access, maybe, for example, you have visitors coming in for events, or you even have a different category of service providers, for example, people servicing the printing machine, etc. So anybody who's going to be engaging with persons on campus will be expected to comply with the policy, because we need to be consistent. If we're going to expect staff and students to be vaccinated, then it's only fair that those that are entering our campus follow and do the same. So that would also be, there are certain functions on the app that would accommodate third-party contractors, and also some mobile devices for visitors, etc. So that would be made available on campus. I hope that answers. Thanks, Shozi.
Thank you very much, Kirshni. I wanted to ask one last question around the science, Tracey. There's a few questions about what does fully vaccinated mean. If students are coming from other countries and they've had one shot, can they get the second jab after they arrive? And then there's several questions about boosters. So now that boosters are required, is this going to be part of the policy? And if we go down that line, when will it end? Thanks.
Yes, those are very important questions, and I think the public health community is grappling with those issues, particularly, as I said earlier, complicated by boosters, as the person asking the question has highlighted. I think we are, UCT is not going to make its own policies when it comes to the definition of what is fully vaccinated. And we will look to the government to tell us what they classify as being fully vaccinated. Currently in South Africa, fully vaccinated is defined as if you've had 2 Pfizer vaccines, or if you've had one Johnson & Johnson vaccine and boosters have been made available. In other countries, of course, the definition is different, and it includes boosters as part of fully vaccinated. So I think in terms of what that is, we will be following guidance from the government. With regards to students, I think I alluded to it in the presentation, that we will not currently at the moment, as myself and Pierre have explained, that the vaccine mandate is not active. So there is no student that is being turned away, even though there is a very strong recommendation that students who are getting into the res, particularly because it's a congregate and high risk environment, that they please vaccinate. But what is happening is that when students arrive and they have not been vaccinated, they are offered information and counseling if they need to, and there is access to the Forest Hill vaccination site on campus that students are then requested to present themselves and receive a vaccine.
Thank you very much, Tracey. Before I hand back to Pierre, I was wondering if any of the other panel members would like to say anything, comment, answer any question that I would have missed that seemed important to address today. Okay, I don't see any volunteers, so I'm going to hand over, and I want to thank everybody for your really interesting, pertinent, important questions. I'm sorry we haven't been able to answer all of them. I've also noted the question as to whether we can share the results of the surveys, and I think that's something we would have to discuss as a panel and respond to at a later stage. Thank you very much.
Thank you, Jose, and thank you everybody for attending this and for asking interesting and sometimes difficult questions to answer. I will again just encourage those of you who might have a specific suggestion or criticism of a part of the policy to make use of the opportunity to submit your comments and suggestions by the end of the month. And yes, personally, I found the questions and the kind of questions asked quite interesting and stimulating. For example, the question of what actually would constitute disinformation is something I think the panel and many of the other issues the panel are going to take up and discuss. So thanks again for joining and spending 1.5 hours here, and that is all from us. The panel will submit a final draft after, of course, further consultations have taken place and we have reviewed all the comments. Thank you very much.